But the price can vary from around €700 to up to about €2,000, €3,000, just depending on the age and also the pre-existing conditions.
Hi everyone, so I'm Leticia from Coming to Spain. So today I'm excited to be joined by an expert in the space. Ciaran from Ino Insure has a lot more experience than I do. He's been in the space for over 2 years now and has helped over 100 expats looking to move to Spain, securing the right health insurance. By the end of this video, the goal would be for you to have clarity on what insurance to select and what are the different steps to put in place. So without any further ado, Ciaran, thank you for joining me today. How are you?
Hi Leticia, thanks so much for having me on. I'm really good. I'm really looking forward to the video today. Looking forward to helping kind of give information for people moving to Spain regarding health insurance, as you mentioned, very important topic. So I just wanted to provide, and answer the questions you have, give that important information to the viewers, and I'm looking forward to it. Thanks so much for having me on.
Thank you. And as you know, you and I have been working together for a few years. I always send you a few emails. There's always questions. So today I think it's a great opportunity to consolidate everything in a short video. So let's just start with a bit of an introduction.
Yeah, great. So I'm Ciaran. I'm from Ino Insure. Ino Insure is an alliance of official international offices of the leading health insurance companies in Spain. So we work with ACISA and DKV. And what we do is we provide visa compliant policies. So health insurance policies that meet all visa and residency requirements. So if you're moving to Spain on a visa, such as the non-lucrative visa, digital nomad visa, student visa, entrepreneur visa, our health insurance policies comply and meet all of the visa requirements. And that's an important thing when you're moving to Spain, and it can be quite different from the country you're living in. So we provide clarity and visa compliant policies that meet all of the requirements for you moving to Spain.
And you've already touched on what I was going to ask you, but why is health insurance so important?
Yeah, exactly. So if you're moving to Spain, as I mentioned, on any of the visas, or you're a resident here in Spain, typically you'll need visa health insurance that complies with the requirements. And also there's people who are living in Spain and just want additional private health insurance as well. So you may have access to the public health insurance and the public health care system, and you also want additional private health insurance on top, which is what we offer. So if you're coming to Spain on a visa or on a residency permit and you're looking for health insurance, we can help you. But if you're just looking for private health insurance to just have additional cover, we can help you too. So that's why it's really important, as it's a one important step of getting your visa to move to Spain.
Amazing. And what about the public health insurance in Spain? How does it complement, and who can have access to it? Like, can anybody who comes to Spain claim it? What are some of the key requirements?
Yeah, so most importantly, and the common thing about public healthcare is that if you're a resident in Spain and paying your taxes here and contributing to the Spanish social security system, you'll have access to the public healthcare system, which a lot of people do. Spanish nationals or Spanish residents living here, you have access to the public healthcare system. If you're coming to Spain on a visa, as I mentioned, like a non-lucrative visa, student visa, or you're applying for your residency card here in Spain, you'll need private health insurance and you won't be able to access the public healthcare system. This is in most cases, and that's why people come to us and are looking for private health insurance, because they don't have access to the public healthcare system. But the public healthcare system in Spain is really strong. It's very well known, and that it's a very top healthcare system. An important reason why people move to Spain as well. So if you have access to the public healthcare system, then you don't need private health insurance. But as I mentioned, many people like to have the two, and if not, you'll just need private health insurance if you're coming here on a visa and you're not contributing to the Spanish social security system.
Yeah, and that's a good point here, because I'm one of these people who have both private and public health insurance. Currently, I'm working in Spain, so because I'm working in Spain, you get access to the public health insurance. But what I found, the benefits of having both, especially in specific situation, in my case, this is something that I had mentioned to you and a few of you guys following me. But when I got pregnant last year, one of the I was doing kind of following the whole process with the public health insurance, but actually having the private health insurance added an extra kind of layers of kind of peace of mind, because in many cases, so last year, for example, for those of you in Barcelona, you may be familiar with the big strike that the public health sector had. So it meant that a lot of my appointments got cancelled, and also when you go through the public health insurance, there's some limitations. So, for example, when you're pregnant, you only have access to 3 ultrasound, one at each trimester, which, depending on whether it's your first pregnancy or not, it might be enough or not. But in my case, I found that being able to have my private health insurance and have extra ultrasound, being able to, when my appointment with my midwife were cancelled, being able to just quickly get on the app, find a doctor nearby, it was really good. And in general, many people do this, even people who are actually from Spain. Like, I have a lot of friends who were born and bred in Spain, and they will have both kind of the private and the public health insurance. So I just wanted to double down on that, because even for those of you listening to us today and thinking I have access to the public health insurance, it might be worth considering. And speaking of which, I also wanted to ask you, is there any kind of common misconception that you're coming across a lot that you would like to kind of unpack today?
Yeah, that's a great point you make. So an important one is dental. So with our health insurance policies, dental appointments, checkups, simple extractions, and a once a year annual dental clean is included in the health insurance policy, which is a common. People may think that it's separate, but you have some dental coverage included in your health insurance, which is nice to know. And other misconceptions maybe that people have is in Spain with private health insurance, with our policies, and it's quite common with the majority of private policies here in Spain, medications or prescriptions aren't covered or included. So if you go to the doctors, of course it's covered and included. But if they say you need a prescription or need some medications, you'll go to the pharmacy and you'll have to pay for the prescriptions yourself. So medications and prescriptions, unfortunately, are not covered, and you need to pay for them yourselves. And another common maybe misconception is regarding vision. So if you're looking for an optician or you're looking for glasses or contacts, of course an eye doctor is covered and included with your health insurance, although an optician or glasses or contacts are excluded and they're not covered. So that's a common question we get asked. So typically vision insurance isn't included in the health insurance policy.
Yeah, I think it's this pretty common practice. I mean, back home, when in France, in the UK, I mean, I've seen this happen often. Things that tend to have a higher cost. And this got me thinking. So I was telling you about pregnancy. So what about someone wanting to contract health insurance for CISA, the KV, and in general with private health insurance? If you're pregnant, would that be covered? Would it be considered as a pre-existing condition? Like, how does it?
Yeah, so with our health insurance policies, we'll always submit and to try find an option for you, and we've insured many pregnant clients. We need to find some information from you. Once we have that information, we'll submit it to the medical review team, and then once approved, you'll be able to be insured, and your childbirth will be covered with your private health insurance in Spain. If you have a health insurance policy and then you find out you're pregnant after you purchased health insurance, after 8 months, the pregnancy is covered and included, which is interesting to know. So if you're pregnant before, you need to let us know, and we'll try to find an option for you covering the childbirth, which is an important and common question that people come to us with, and we'll always try our best to find an option for you covering the pregnancy.
It's a big one, and this is something that I'm asked a lot about pregnancy. Then later we'll discuss a bit more like premiums around the pre-existing conditions and age bracket, but this is a big one, so it's good to get clarity on this. And it kind of leads me on nicely to one of the questions that I'm sure people listening to us today very interested in, is like the cost and how you guys kind of pricing. Like, what's the typical cost range, and what are the factors that influence the price and a quote that you get for your private health insurance?
Yeah, so the cost of the health insurance depends on different factors. So for example, age is a big factor in terms of determining the price. So the price for an 18-year-old is going to be completely different to a 70-year-old. So the age is an important one, and then also pre-existing conditions. So if you have some pre-existing conditions, and depending, each case by case, the pre-existing conditions will change the premium. So age and pre-existing conditions are the two big factors that determine the price, and it can vary from a couple of hundred or might rise into the thousands, just depending on the age and the pre-existing conditions. But if there's any, of course, specific cases, we'll help you provide a quote for you and have that plan set up for you. So regarding pre-existing conditions with our policies, similar to pregnancy, we'll have to ask some questions. So what are the conditions? When were you diagnosed? Any medications? We'll submit that to the medical review team of the health insurance company, and once confirmed and approved, we'll be able to offer you a policy covering and including the pre-existing conditions. So that means consultations, checkups, these are all covered and included, and then high-tech examinations and surgeries, they'll require authorization, and will just depend on the authorization department. But that's how it works in terms of pre-existing conditions, and it's done on a case-by-case basis, so that's important to know as well.
So I guess it would be hard for you to give me like an age, like a cost, like a bracket, like how can it vary? The average cost for private insurance, like what can people expect? I guess it's very, if you do have a ballpark for people to have in mind.
So of course. So the price can vary from around €700 up to about 2,000 euro, 3,000 euro, just depending on the age and also the pre-existing conditions. It can completely change if you have one pre-existing condition to another, but about 700 to 2,000, 3,000 euros for an annual.
Exactly, that's what I was going to clarify, just so people don't get scared.
An annual quote, It's not a monthly quote.
That's what I was going to say, Ciaran. Let's clarify. We're talking annual, and also it's good. I think it's for me to jump on that. Why are we talking annual? So why is it so important? Because I know people always ask me about, when it comes to cost, can I not pay for 6 months and then? But I know this is also a key requirement as part of the visa application. Yeah,
so the visa requirement typically, and the residency requirements, is that you have health insurance covering your time in Spain. So typically that will be for the 1-year visas. It'll have to be paid up front for 1 year. If you're studying in Spain and you're studying in Spain for 3 months or 6 months, you can just purchase for 3, 6 months, 9 months, depending on how long you're studying. But typically, if you're here on a residency or a visa, such as a non-lucrative visa, it'll have to be paid up front for at least 1 year.
1 year, and then you would just have to keep on renewing as you're saying.
Exactly. You'll have for example, a 1-year policy, and then when you renew your visa, you'll just renew for another year, and then you can just renew the policy for as long as you like. If you are here for 3 years or 4 years, you can just renew annually. And then same with the student visa. If you're here for 3 or 6 months and then you're renewing your visa, you can just renew the health insurance policy then as well.
Okay. And actually, I wanted to go a bit back on what we were still talking about, cost. And like I said, a lot of the people that I talk to that reach out to me are people, kind of old elderly people, so kind of looking at 60 and above. And it's always a big struggle for them, and I think it's a big cause of concern when it comes to finding an insurance. A lot of them are looking to retire to Spain. They're coming from the UK, and they're coming from the US, and they're coming to me to get answers. So I wanted to understand, so for DKV and Assisa, so what is the maximum, and what's the maximum age in which people can join you? Like what?
Yeah, that's a great question. So the highest age that we can insure is 70.
Okay.
So that's to first contract the insurance. So we can insure anyone from 0 to 70. And that's for the first purchase. And then once you purchase, you can then just renew for as long as you like.
Okay.
So if you're 60 or 70, you can purchase, and then once you turn 71, 72, you can just renew the policy annually for as long as you like. Okay. So it's from 0 to 70.
To 70. Yeah. So if you're in your, I don't know if this is something you know, but if you're like older, in your 80s, do you know if there's a way around it? Meaning, do people tend to go with the public sector, if that's a route that people take? Have you ever helped anyone in that situation?
Yeah, so if you're coming to Spain on a visa, for example, the non-lucrative visa, student visa, typically unfortunately, you can't access the public healthcare system, so you'll need a private health insurance, and there's other policies that may cover, you if you're 80 and you can try that policy, or else if you're able to have access to the public healthcare system, then that's another great alternative, because you'll be covered through that. So either finding a policy, a private health insurance policy to cover you,
Yeah.
or else the alternative is to have access to the public healthcare system if possible.
Yeah. Okay. And could you give some tips to the people listening to us today when it comes to, when picking the right provider, which is a big decision because, as we said, especially if you're coming on a visa, non-lucrative visa, or the digital nomad visa, you need to pay a year upfront. So it's a big decision to take. So what are some of the key questions that they should be asking, key consideration that they should have in mind when selecting an insurance that makes sense for them?
Yeah, so really important factors to look out for when you're purchasing insurance is one, as you mentioned, you're coming on a visa, is just to ensure that the health insurance policy meets all visa requirements. So that's full coverage with no exclusions, no deductibles, no waiting periods, no co-payments, and it's similar to the public healthcare system. That's something really important. That's probably the most important one, because it may affect your visa application if you submit a health insurance policy that doesn't meet the visa requirements. And then secondly, another important factor when picking a health insurance policy is that there's hospitals, centres, clinics close to you and that you have access to. You want to ensure that the policy has coverage close to you, whether that's a hospital or just a medical centre. Different specialists are close to you and you have access to them. It's really important. With our policy, it has one of the widest medical networks in Spain, which is important. So that means you're covered all across Spain, so the mainland and also the Canary and Balearic Islands as well. You just want to ensure that you have coverage, whether it's an emergency or you're just going for checkups, that you have access to an important medical network and you can visit the different centres and clinics. That's really important too.
Okay, now that's some good pointers, because obviously I know there's other insurance that sometimes don't have centers and around everywhere in Spain, especially in places like in Cadiz. I know that places in the Canary Island, sometimes they just don't have centers there, so it's something important to bear in mind.
Yeah.
Now let's say that, I'm set on an insurance, or hopefully I want to potentially I'm set on Assisa or DayKiwi. Now I want to understand what is the application process. Can you talk us through, like, how long does it take for me deciding that I'm gonna kind of get an insurance with you guys to me getting it? How does it walk me through that?
Yeah, so we through our website you can get an instant quote just with your date of birth and the coverage periods. You can get a quote, and then from there, if you're set on the insurance, you just and you're happy with the quote, you just continue with the application all online. So just fill in your personal information and details. Then you'll come to the payment section, and then you can pay with any debit or credit card you like. So it doesn't have to be a Spanish bank account. You can pay with any debit or credit card that's accepted. And that process of the online purchase takes a couple of minutes. And then once you purchase, you'll receive an email confirmation with the details. And then within 3 working days, you'll receive your insurance document. So that's the terms and conditions. Also the insurance certificate too, and these are the documents that you'll use for your visa application or your residency permit, and that typically takes a couple of minutes to purchase, and then within 3 working days you'll have your documents. Then once your policy starts, you will receive details on using the insurance and your card number and registering with the health insurance company on the app and the website. And you'll receive once you have a Spanish address, we will send you your health insurance card. And then when you're using the insurance, you just use your health insurance card and your ID, and then you're covered and included once you visit centres within the health insurance networks. And that's the process. So it's quite quick. You can purchase online in a couple of minutes, and then you'll receive the documents within 3 working days. So that's kind of important timeline for purchasing the insurance.
So you receive them via email, so you receive them to your address where you're currently based?
Yeah, so the insurance documents, they're sent via email. So
Okay.
the same email you used in the application, they'll be sent to that email within 3 working days. And then the guides and the information once your policy starts, that's sent via email too. And then your physical card, which looks like a debit or credit card, that's sent to your Spanish address once you have the address here in Spain. Yeah.
Okay. And let's say if it takes you some time to get like a Spanish address, could you send that to the center, the closest center, or you need a Spanish address?
Yeah, we can have it sent to any Spanish address, and if you're if it's taken some time to find an address to have it sent to, if you're currently in the process of searching for an apartment or a house, you can use the virtual card through the health insurance app. So you can use that just exactly the same as the physical card while waiting for the physical card to arrive.
Okay. And well, hopefully this won't be the case for many of the audience listening to us today. But what if your visa application doesn't get approved? So you've done all the paperwork, you paid for the insurance upfront, but unfortunately your application has been denied. Would you be eligible to receive a refund?
Yeah, so in the unfortunate case that your visa is rejected for any reason, you'll receive a letter of rejection or a denial letter. Once you send us that letter of rejection or the denial letter that your visa residency has been rejected, once we have that, we'll then process the refund and your insurance will be refunded. All unused months will be refunded within 30 days. So we just need that letter of rejection and then we'll process the refund to you. Hopefully that doesn't happen and people can get their visas.
Fingers crossed. Fingers crossed, everyone. I wanted to also kind of discuss, which is a big thing when it comes to moving to Spain, like the language. Language barrier is always a big thing. Many people don't speaking Spanish or planning on learning Spanish once they move to Spain. So I wanted to understand to what extent you support expat with English-speaking services when it comes to the app, access to doctors who speak English, kind of all of that, I think can be a cause of anxiety.
Yeah, of course. So that's really important. And for that reason, through us, we offer pre and post customer support in English and several other languages. So if you need some help, you need some questions, you're having an issue, anything related to the health insurance, we offer customer support in English through the telephone, email, and also WhatsApp, and we're there to assist with any questions, any support. We can help finding and booking appointments too, and we can always request and search for an English-speaking doctor for you and request that. So that's really important that we offer this support in English for using the insurance, and we have many guides on registering and using the insurance in English as well. So that's really important that we give that option as well.
Okay, great. Yeah, no, it's a big thing, and this also happened to me initially when I learned Spanish as I moved to Spain, and those things, going to the doctor initially, and I only had the public healthcare, so it was very, very stressful whenever. One thing is you're sick, another thing is you're going to the doctor, you're not able to communicate and explain your symptoms. So this was also a plus of having a private health insurance, because then I was able to gain access to English-speaking doctors, and the app also is a big one. So how is your app? I mean, I've been using it, but I know I'd like you to talk to the audience on how user-friendly, if it's quite easy to navigate, because you've got some insurance, actually, that I've gone through a few private insurance, and some of them you can't book via the app, you have to call. So it just causes friction. So I wanted to make sure that the audience felt comfortable about the fact that you're offering something that is very user friendly.
Yeah, so as I mentioned, we offer the English speaking support for any queries related to the health insurance. And also through the app and the website, you can search for doctors, centres and clinics, and you can also filter by distance.
Okay.
and language as well. So you can filter by, there are some, of course, Spanish speaking doctors, English speaking doctors, and also French speaking doctors as well. So just depending on the centre
Okay.
and the clinic or the hospital. But it's important that you can search for centres, hospitals, and also book appointments directly through the CISA app and website as well. So that's really important, and that's what I use a lot when I'm looking for an appointment or a centre. You'll just include your address, choose the specialty you're looking for, whether it's a general doctor or a dermatologist or a cardiologist, and then you'll click search, and then you can filter by distance, so all centres closest to you will appear, and then you can also filter by language as well, and it'll show the English speaking doctors, which is important for you to when you're navigating the kind of Spanish healthcare system coming from a different country. It's all new, but we're there to help with customer support as well. So you're never alone when you're trying to navigate in that kind of difficulties in changing from kind of one healthcare system to another, but we're kind of there to assist.
Amazing. And again, for wondering, specifically of ACISA, so there's a range of health insurance out there for people to, to pick from. So what would you say really sets you apart, again, when people are in the selection process? What are some of the key criteria, key things that, draws people towards your insurance, and why you believe, like today, people listening to us today, this could also be a good option for them?
Yeah, well, there are several reasons why the policies we have are good options, and as I mentioned, the ACISA and the DKV. So with both of these policies, there's national coverage with very wide medical networks. So that means that you're covered across Spain, the Canary and Balearic Islands as well, and also there's many hospitals, centres and clinics around Spain to choose from. So it's not only just the bigger cities like Madrid, Barcelona, Valencia, and towards the south of Spain. All across Spain, there's many hospitals, centres and clinics to choose from. It's really important. And then secondly is the full coverage. So full coverage, no waiting periods, no co-payments, no deductibles. So you pay for the insurance, and then once you visit centres within the medical network, the wide medical network I mentioned, you're covered and you don't have to pay, which is kind of it's an easier process than visiting centres, paying and then having to be reimbursed. Another option as well is many clients or people come to Spain and they want to travel. If they're coming from the other side of the world, they want to travel across Spain and across Europe. So with their health insurance policies, you have emergency travel assistance covered and included in the policy. So if you're traveling to France or Germany or anywhere in the world except for your home country, you're covered in emergencies, which is a nice benefit of the health insurance policy too. So there's several different reasons why they're good options. As I said, if you're looking for a visa or residency permit, it's always best to ensure the policy meets the requirements, which ours does. It also has a wide medical network, the travel assistance that is included, and also the dental coverage as well. So there's many different things there, just the kind of maybe main benefits of our policies.
Yeah, no, and I can't agree more. Having accessibility to a lot of centers, because once you move to a new country, there's nothing more stressful than not having medical center close by. So I think this is definitely a number one factor to have in mind for people listening to us today. So that kind of leads us to the end of our chat, which I think hopefully was super helpful for everyone. And I wanted to ask you, kind of give you the final opportunities to give any piece of advice for anyone. I know we've touched on many things, so maybe you've touched on a few, but if there was a last piece of advice that you wanted to give away before we close that session.
Yeah, well, thanks so much, Leticia. It was really enjoyable speaking with you today, and hopefully we're able to give valuable and important information. Of course, there's a lot, so we touched on some of the important points, but if anybody had any further questions or specific questions about their case, we're here to help you, so you can reach out to us. We'd be glad to help with any questions and queries and finding a health insurance policy for you too. That's really important, and yeah, we'd be happy to help. And as I said, it's quite a it might be a big change, but Spanish healthcare is really, really good, and it's well known that it's a very strong healthcare system, both public and private. And if you need a private health insurance policy for your visa, for your residency permit, or you just want to have additional coverage, then we'd be happy to help you with a quote and then provide a policy if you like.
Amazing. And well, in the description we'll be popping a link for you guys to be able to request a quote. You probably will be talking to Ciaran, so now you know who he is, so it'll be easier to start the conversation. So again, Ciaran, thank you so much for your time. Hopefully we'll do many more sessions like this, as you know, we keep on getting more questions on health insurance, and as I'm seeing that there's a lot of momentum. I think Spain is becoming, and hopefully will continue to become a destination chosen by immigrants around the world, and hopefully we can support them. So thank you to everyone. Thank you, guys.
Thanks, Leticia. Thank you.
Thank you. Bye.